Hi. So we go to the fifth video in our series. Um, this is regarding another common question that they've asked, which can be a little bit confusing. So just learn these two types of not common fractures. So one is they ask about pseudofractures, or they call it the milkman's fracture. So what is it? That is one question, and the other one is pathological fractures. You should know a little bit of distinction between the two. They both are pretty similar, but we should know what is what. Okay, so milkman's fracture, pseudo fracture, otherwise called as loser zone, otherwise called as osteoid seam. Okay, so these are like insufficiency fractures. Okay, so the bone is a little weak for some reason, and these fractures they develop, most probable reasons that say is when the bone is so weak that whenever it is in close contact with the vessel, okay, there's a pulsating artery. With every bit of pulsation that happens, it slowly causes erosion of the bone, and thereby you see those lines on the x-rays. So these lines, how are they that they have asked? Okay, these are narrow radiolucent band like lines which are parallel to the cortex of the bone, and they are usually bilateral and symmetrical because it happens secondary to these arterial pulsations, which are, these arteries are usually bilateral. Okay, so what are the common sites that you can look for? Very common site is scapula is a flat bone and there is a lot of vasculature around it. The other common site is the pubic and the ischial rami, the superior pubic rami, inferior pubic rami, and the ischial rami. Okay, and then in the proximal femur, it's mostly on the medial aspect. So the medial femoral neck and femoral shaft, and then the lesser trochanteric region. These are very common regions. Other regions, clavicle, the ribs, okay, and lower down you have the proximal radius and ulna, and then the metacarpus, metatarsus, and the phalanges. Okay, so these are common sites where you should know. Most important things are the pelvis, the medial side of femur proximally, and the scapula. So those are the commonest sites. If you don't remember anything else, these should be remembered. And what are the common causes for these loser zones? Foremost, you should know is always vitamin D deficiency. So if there is a choice, then that is the answer. So osteomalacia or rickets. Other causes they've asked, one is hereditary hypophosphatasia, and then renal osteodystrophy, okay, and then Paget's disease, lower down fibrous dysplasia. To me, osteomalacia, rickets, you should remember, and these are insufficiency fractures, right? So all of these can make the bone weak. So keep it in your mind. They can all be one of the differentials. Okay. Whenever you have, there are so many things, especially in orthopedics. I've seen with regard to your MCQs. They it's like there are many conditions, and you should know multiple differentials, or you should know multiple conditions. So it's very hard to learn everything by heart. But the advantage is these are multiple choice questions, and you see those choices. So just keep doing these questions. You can only remember all these choices. You cannot by heart all of them. You would forget the next day. When you keep doing these questions, your mind can sort of uh, take you to the answer. You would feel at some point, yeah, I have it feels a little familiar, this doesn't feel familiar, and that's how you go ahead with it. Don't try to learn all these differentials by heart. You should know the important ones and know the concepts. So this is with respect to pseudofractures, you should know it's an insufficiency fracture. Anything that makes the bone weak, you know the pathology. It's mainly the pulsating vessels, and most common is vitamin D deficiency. Okay. In terms of pathological fractures are usually the complete fractures. It's again a big bone that is weak, and that causes the bone to completely break. So these are sort of different from the, so obviously different from the pseudofractures. Okay, if the bone break is complete, and it can be what are the causes of pathological fractures? This they have asked a few times. So know them. It can be due to a localized disease, okay, or due to a generalized disease. So the generalized disease most common. The generalized disease most common cause is osteoporosis. Okay, you should remember. There is osteogenesis imperfecta. Osteopetrosis can also cause. That's one of the questions. Osteopetrosis, if you remember, it's a problem with the osteoclast. So the bone turnover is decreased. So the bone actually looks very sclerotic, but because it's not turning over, that is, new bone is not forming because the old bone is not being taken away. So it's the same old bone that has been there. So the bone is actually weak. So this osteopetrosis can cause a pathological fracture. Remember that. Osteomalacia, rickets, which are vitamin D deficiencies. Scurvy can be a cause. Why scurvy? Scurvy because the collagen, one type fibers, which actually help in the formation of bones, they are not well formed in scurvy. So they can cause pathological fracture of the bones. Okay, remember that. That's important. And then otherwise, Paget's disease, it's a cause for pathological fractures. Again, the bone turnover is decreased in Paget's. And then other problems uh, like histiocytosis X, it's a lytic region. All the lytic lesions of the bone, they actually, there's no bone, right? That's why they are lytic, they look lytic. They can all be causes of pathological fractures. Some things which I've asked is multiple myeloma can cause pathological fracture, any tumor for that matter, osteosarcoma, Ewing sarcoma, all of them can cause. Okay, and then Gaucher's disease. Okay, so this is more of the generalized disease, and then localized diseases which cause pathological fractures. It can be osteomyelitis, can be tumors as we previously saw, giant cell tumor, all lytic tumors. Okay, the blastic tumors may not be the cause. Metastasis, Ewing sarcoma, osteosarcoma, and then all the cystic lesions like aneurysmal bone cyst, unicameral bone cyst. They are all common causes of pathological fractures. And last but not the least, eosinophilic granuloma histiocytosis. So these are all common causes for pathological fractures.